सोडलं.
त्याची काय चुकी आहे? त्या थिएटरवाल्याची चुकी.
पहिली गोष्ट त्यांनी
तुझ्याकडे जर
कशाला घ्यायचं तेच की तुला जो
तू
क्राऊड
हाऊसफुल
येत होतं.
लावतच होतं तुझं, तर तू आधीच तेवढं हे करायला पाहिजे होतं ना.
So you might be wondering why change in the topic. The thing is the auscultation part, I thought, because as I was preparing, say we need to discuss some of the concepts of, say, mitral stenosis or mitral regurgitation, aortic stenosis, etc., in more detail, so that actually you understand that why those murmurs, etc., are occurring. So we'll have, not now, right, because after some time, we'll be starting with, say, the right, the pathology part. That is the cardiac pathology. And we'll see 8 major conditions. And then we'll be going for the auscultation part. But before that, we'll be having one session of auscultation so that you can start practicing. And you can listen to your own heart. That session will be taking next week. And in that, I'll be explaining you that where exactly those murmur, which are the areas. So at least actually, say, till you go to clinics, all those concepts will be clear. But diving deep into it, say for example, when most important is the mitral stenosis. So when we'll be going for mitral stenosis, so we'll not be leaving anything. Like we'll be discussing multiple cases, along with what are the auscultatory findings, how it will really look it into on the echocardio, and in case if in some of the cases we might be going for CT or the MRI, then what would be the findings, along with the case studies. This is something which is in my mind for some 8 major conditions, which are part and parcel of the not only USMLE but as such your life. All right, it's time. Let's start. So today we'll be talking about the histology. Now in histology, just let me show you very say some all those key points. Today you don't write anything, just understand it, right? Because all the keywords I'll be writing it over here. What you have to watch, say all these slides, they are the real slides, and on my, so this is the lowest resolution, right? Then same slide will be going for higher resolution. Same slide will be going for oil. Right? Same thing. This is oil immersion. So this is where you will, the cells would look like as if like a masterpiece, right? That's how beautifully every cell will be seen. This particular thing, which is over here, and which is over here, and which is over here. See, this is what we are zooming in, right? So that way you'll be getting a complete understanding. What we shall be following is this pattern. This pattern. I'll write it over here. Any slide which is given to you, because this histology sometimes it is considered as a very confused thing. At least, yes, it used to happen when I was in Mbbs, because teacher would show in microscope with a marker that watch, these are the cells. These are the stratified squamous epithelial cells. We see it, we say yes, yes, but many times what really happens is that on one particular slide, not all the areas they are seen very clearly, right? Now, because teachers, they are so experienced that they will be able to understand that, okay, this is this particular type of cell. But in the initial part, right, at least I was finding it difficult to understand that what it is. Now, as the time progresses, then you start understanding, but no. So that's why what I did is, even in BJ Medical College, we invested in trinocular microscope, so that not only that you are watching it, but it is connected with one camera also. So same thing is over here. Right? So I've taken all the images. Once this entire histology, today and tomorrow it is over. Again, one day if we are keeping for auscultation, another day we'll be keeping for live histology. What live histology is, we'll put the slide, and then actually you'll be, as I move the slide, you'll be able to see it on your screen. So we're planning for even that also. So here we'll see that particular image, its identification points. Not to worry that which part it is, identification points, and then in which area these type of cells are present. Now this entire material, it is about not less than say 35 files, individual files. So when I say that this is simple squamous epithelium, just simple squamous epithelium, it is present in arterioles, arteries, internal lining of heart, kidney, globuli, lymphatics, alveoli, right? These are the areas. All these, what you are watching, all the way, all of them, they are simple squamous epithelium. And at the end, there is a repetition of the first page. So that once again, it is a sort of revision. This is how we complete one type of cell. All the type of cells, they are designed like this, so that wherever they are present, at least you'll be having the idea that yes, say if this is like lymphatics, we zoom it and we see that yes, these are the cells which are absolutely flat, and this is the speciality, because speciality is the nucleus. Right? So that's how we shall be proceeding. So let's start with the first one. This is simple squamous epithelium. Whenever we say squamous means flat. They are flat, right? And simple means there is only one layer. Right? Topic is histology. Histology. What we see, no worries, no worries. So this is just the beginning. This is just the first topic, first slide or the first page. So simple squamous epithelium, right? So this is a single layer. That's why we'll be calling it simple. So whenever the word simple will come, means it is a single layer. And squamous means these are flat, right? Obviously quite thin. And when the cells are, think it like this. This is a cell, right? If it is a flat, so then the nucleus which is lying inside, this would be the shape. This would be the shape. Now this is the catch point. You'll see just in a minute that many times this particular shape of the cell is not seen, right? In theory, it is easy to say that yes, the cells are flat and this, that, all theory. Many times you will see that you won't be able to see it. But nucleus is something which is always seen. Why the cell is not seen? Well, the cell is consisting of cytoplasm. We are using HN stain, right? So in this particular stain, if the cell wall is broken, right? If it is broken or the cytoplasm is lost, then it might not get stained properly, but nucleus will always be stained, right? It is a big structure. So that's why our focus will be on nucleus. So if we see the nucleus, we'll be able to identify the structures, identify the type of cells very easily. So this will be our focus. First thing. This is like disc-shaped central nuclei, disc, right? Or it is oval. It is oval shaped. So will it like all the other cells as they will arrive, they will be having different type of nuclei? Very true. When we'll be watching the cells which are like this, so they will be having a very round nucleus, pretty geometric, right? And when I am telling you that it would be a round nuclei, no way you'll be missing it, right? It will be so distinctively different. And when the cells are like this, long, right? Long, so yes, the nuclei will also be making their shapes like this, right? So this will be a major difference. Now, this makes entire discussion very easily. Yeah, this is just the beginning. We are discussing histology today, right? So this is just the first topic, simple squamous epithelium, one layer, and it is flat. When we say flat, we will be focusing on nucleus, right? Small amount of cytoplasm. So the cytoplasm which is over here, right? There is a small amount of cytoplasm, small amount. Now this small or less, small or more, this is a relative term. So don't worry much about it. These are the two major identification parts. Where is it present? Anywhere where, because it will be forming a thin layer. Right? So wherever the transfer is to be done, oxygen oxygen carbon dioxide transfer. So alveoli, no doubt about it. Right? In the edema, we learnt about the importance of lymphatics because it will be draining that fluid. So again, lymphatics, very important. Right? Arteries, arterioles, arteries, important. Internal lining of the heart, very delicate, correct? And kidney, glomeruli and corpuscles. So glomeruli, that is where, because that is the area from where the water has to enter in, right? And the entire ultrafiltration process will start. So it makes pretty good sense that things should be present over here. Nothing, simple squamous epithelium, a simple layer, right? A simple layer. Here it is. This is arteries, and what we watch over here, see the cut section of the tissues, and you can see several small arterioles, right? Several small arterioles. See all of them, right? So why they are seen like this? Because it is a section which is taken, right? It is cut, a section which is taken, and then with the help of microtome, a section is taken, and then we are watching it, correct? So here it is. We are focusing on this. Here also, it is seen, but not that clearly. But over here, we can very clearly say, forget about anything else but the nucleus, right? See over here, it is just the nucleus which is seen very flat, right? Disc shaped over here, right? Over here, very less cytoplasm in this particular area over here. Right? But see, these are the disc shaped nuclei. So this tells, sometimes you might be watching something like this. This is nothing but it is just the overlap of the layers. It happened because this is all natural. So that's how, see, this is, it appears. Let's see some more, right, from same section. Right. See the disc shape. Correct. Zooming it to oil immersion. Cytoplasm, well, this is where we see the cytoplasm. See, this is a complete cell. Very, very beautifully we can see the entire cell, right? This one is nucleus, and see this structure, this one, that is cytoplasm. That is cytoplasm, right? This one is nucleus. So that one is nucleus and this is cytoplasm. Say in this cell also, right? In this cell also. And yes, you can see that nuclei are pretty big. Now, the areas, right? See, this one. This is blank. Right? So for some reason that some of the wall must have broken, cytoplasm has left. So we are just watching a blank area. That doesn't mean that there is no cell. There must be cell. Right? But when we see like this, it clearly indicates that what we are watching. Okay, so that was like we were watching all those arterioles. I'll keep on writing. I'll keep on writing. So, arterioles or small arteries. I'll just write over here small artery. Here it is. So these are the lymphatics or the lymphatic channels. This whole thing. This is 10x. We move to 40x. And this one would be the oil immersion. Right. So this is 10x, 40x, and this one is 100x. right? Same image. Let's go back. Here it is. The dot structure, but even visually also, if you really see, though, we can see that something like this, right? So that is under low resolution. We see it as we zoom it immediately. This is clear, right? See the flat or the disc-shaped nuclei. So when you see these disc-shaped nuclei which are arranged in one line, so that's why we'll be calling them the simple squamous. It looks like, see, in some of the areas, right, they look like this only. But we have to just look at the majority. Right? Many of the nuclei, because it happens like when the microtome passes, at times it might damage even the nuclei, right? It might damage any of the nucleus and it looks like this. But overall picture, if you see, the overall picture is of all those flat nuclei. We zoom further and it is very clear, right? See this, right? All the way. So this would be the whole cell, one complete cell. So that's nucleus and the cytoplasm. A very classical thing, kidneys. Asked in exams so many times. So what we are watching over here, say in kidney, the structure is nephron, right? Now this is a cross section. So when in theory, when we study, right, I'm drawing on this one. So we study that, okay, this is the glomerulus, right? It has got afferent and the efferent vessels, arterioles, and then this is the tuft of capillaries. And then we have got proximal convoluted tubule, then this is the loop of Henle, distal convoluted tubule, right? And then they will be going for those collecting ducts, everything. Now when you take, now this is the theory, right? We'll never ever be able to watch the whole glomerulus like this or the whole nephron like this. This is the nephron. It is impossible, right? We won't be able to watch a separate nephron like this. Now in kidney, there is cortex and medulla, right? So that's how they are all arranged. So when you are taking a section, right? When you are taking a section, so that particular section might be passing like this. So it will be having a cut section of this glomerulus. It will be having some, say over here, the collecting ducts are cut, or the section is passing through this level, any of the, so Bowman's capsule, right? Yes, that would be cut. Then the collecting ducts would be cut. So everything, right, is seen over here. So here it is. Watch this. See this. Here it is. Right. See. Right. So they are seen fully. In between, we have got those tuft of capillaries. And then all these areas, right? All these areas, right, which are round, they are all collecting tubules, right? So thus it is a combination of everything what we'll be watching. So let's be now more, or let this image remain, doesn't matter. So when we wrote it over here, kidney, glomeruli and the corpuscles, right? So here it is now. We focus only on this. Right, here it is. Now they are seen more clear. Right. So that's the glomerulus, and we are interested in here it is. See the lining. See this. That's the glomerulus. These are all collecting tubules. These are all collecting ducts. right? And you can immediately see the structure of the nuclei. They are all round, right? So that means they are of different type. Right now, we are watching just this, our Bowman's capsule, right? See its lining, and inside all are simple squamous. Simple squamous, right? Here it is. Now it is in center of this. So this one. See over here, there's cytoplasm. We are unable to watch it very properly. Right? But yes, from the nucleus, we can crystal clear. We are very clear that this is simple squamous. So this is how it is to be identified. All the circular structure, they are collecting duct. You are right. They are collecting ducts. Right? So here it is. One big cell. This is oil immersion, right? So this is a complete cell. This is another cell, right? This is another cell. This is another cell. So that's how they all are. See, right? These are simple squamous epithelium. Great. So these are the simple squamous. Now we just watch it over here. This one, right? See the nuclei. They are big, round, and if we really draw the cell look like this. Right? Cells, they are looking like this. Over here, this is also cell, but see, for some reason, right, we are unable to see the nuclei properly. Right? The cell. Sometimes they are not even stained properly. Say, for example, this nuclei is stained less. Happens. But yes, the overall picture in this, it is telling that the structures, they are no more flat. Right? So these are the structure. This will take us to the next topic. So I'll just save this. And I open another file. So this is simple squamous epithelium. This is simple squamous epithelium. Again, simple, that means it will be single layer. This is cuboidal. Cuboidal means cube-like. It means it has got height and width both. So that's the shape. Right? They are the cube-shaped. Via nucleus of every cell. Yeah, because some of the nucleus, either they are not stained or they are lost. Right? Because sometimes if the cell wall is broken and entire content is lost, so it happens. Right? Because it is a microtome. Microtome is it cuts and takes very thin slices. Okay, so large round nucleus. This is the key word. This is the key word, and because the nucleus, they are big, they are round, so they will be quite proper. So you'll be able to see them quite beautifully. Right? So this is the shape, and moderate amount of cytoplasm, because now the cell size is also big, so we'll be able to see some amount of cytoplasm. So where they are present, kidney tubules. Right? Kidney tubules. In fact, by the end of today's session, you'll be able to watch so many, almost the entire, in 2 days, you'll be learning the entire histology, whatsoever is asked in first Mbbs. So this would be the normal histology, right? Normal histology. So when we'll be learning pathology, we'll be starting from this point only. Because all these structures, say kidney tubule, so then there'll be histology of kidney pathology. So what can go wrong? The cell types can go wrong. Some abnormal structures, they might appear, right? So that is what you have to understand. So from normal, once you learn the normal histology, the files, I'll be uploading all the files, right? It is my entire collection. I'll be uploading all the files. You'll understand it today, but time to time, every 10 days, 15 days, 1 month, just go through these files so that picture remains clear in your mind. Right? Okay. So kidney tubules, ovary surface. So ovary surface and ovarian follicles. This is when you will be learning the menstrual cycle, right? In embryology. At that point, you come back to these images because it has got all the stages. Some follicle is fully mature, some is just the beginning, all stages are seen. Similarly, parotid gland, right? Parotid gland. We have got three glands which are secreting the saliva: parotid, submandibular, and sublingual. So over here, parotid glands and secretory portion, and secretory glands like sublingual and submandibular. Now see, this is a difference. There is a difference. So we will come to this as we discuss. So let's start with kidney tubules, which is easy. Same slide. It is the same slide, same image, right? We zoom this thing. Say all these are our glomerulus, and as we go and as we zoom, same image, right? Now we are clear that this is right, big nucleus, cuboidal shape, right, cube shape, and side by side comparison of a squamous. This is squamous, correct? This is squamous. Okay. Now this, so I just write kidney. The next one is ovaries. There it is. Now, what we wrote over here, see, ovarian follicle and the ovary surface, right? So these are the areas which we have to focus, because see, when we take a cross section of the ovary, so many type of cells are there, right? But we'll be focusing on its surface and the ovarian follicle. So here it is. We just zoom this ovary, right? We zoom it still more. We zoom it to the maximum. Now see, here it is. Just for the understanding. Here is the uterus, fallopian tubes, femoral end, ovaries are here, right? So that's the ovary, same on the opposite side. So from this surface, that ovarian follicle, as it matures, it reaches to the surface. It reaches to its surface, so it reaches over here, and then it is released. With those femoral ends, they catch this mature one, and then it starts traveling all the way into the follicular, into the fallopian tubes, right? So what we are watching is one, the ovarian surface, and then we'll see the ovarian follicle. So here it is. See, as we zoom, this is the surface. See, this is the surface, and here you might feel like that, yes, that every cell is individually not seen very clear. Very true. It is not seen very clear because this is a very thin surface, but nuclei, beyond doubt, we can say that yes, definitely this nuclei is not flat, right? Or it is not the oblong. No, none. This is more towards they are the round nuclei, right? So these are the round nuclei or the nucleus, and this is the surface of the ovarian surface. So every month, either from the right side or from the left side, right, this one follicle that would be released into this cavity. Got it? Okay. Now, see, this is still a zoom, still further. Now, this is the oil immersion. Right? That's the oil immersion. This is now we are watching on 100x. So, see these cells are completely a very nice round. These are like two cells. There is one nucleus over here and there is overlap. How can you say that? Because in between portion, when you'll get this file, you'll find that it is bit darker. So one nucleus and another nucleus, right? They are a bit overlapped. So, but all of them, we can say that they are round. So this is done. See. Now we are inside the ovary, right? Watch for these follicles. See, all these follicles, some they are quite big, mature, going towards maturity. Some are just in the initial stage.
झोपलेला आहे का काय? फोन लावून चाललं. Disturb नको
So
करू
we
त्याला.
pick up one, right? See over here, the layers, they are just developing. And we zoom this thing. This is one ovarian follicle.
आम्ही पागल आहे का? फोन करणार आहे, उचलायचं नाही
This
तर.
is one ovarian follicle. When we'll be learning the embryology, you'll find that in case of female, right from the birth, the number of these ovarian follicles, right, they are fixed. Those fixed, they are deposited into the right side and the left side, and one after the another, right, during her entire life. One is released every month from either right or left side. So they mature, but those immature, halted states, they are lying over there, right? And here it is. This is the oil immersion. Yeah, that's the oil immersion, 100x. So over here, giant, see these, right? These are the round. So that's watch. Okay. The next one is, see. So we understood the kidney tubules, the collecting ducts, ovarian surface, ovarian follicles. Now it comes to this parotid duct and the secretory. So our salivary glands, our main salivary gland is parotid. It is parotid. It is into this temporal region. It is over here. Right? And when you chew, so it releases that saliva. But apart from that, there are two other types also. It is called as the submandibular, right? Mandibular and sublingual. In head and neck, there is separate dissection and in-depth understanding of all these three glands. Also, tomorrow we'll be learning one more extra topic, and that is called as the glands. That what are the different types of glands in the entire body. So once you have understood this thing, then there won't be any confusion between that. What are the type of glands into stomach, jejunum, duodenum, large intestine? What are this type of glands into our mouth? What are the other type of glands that just secreting various hormones? Everything, right? In one session we'll be completing. We'll be having a total understanding of all the types of glands. Correct? So over here in salivary gland, parotid, submandibular, and sublingual. Parotid being the important. Parotid duct is that tube which is carrying that saliva and which is draining. This parotid duct, over here we are talking about parotid duct. Right? We are not talking about the parotid. So parotid duct and the secretory portion. There is a portion which will be secreting this saliva. Right? So that secretory portion. Now why I am differentiating between them? Right? Today we will not be elaborating much on that because it is a part of this glands. So in the glands we will be discussing this part. That what are the acina type of gland? Because there are some type of glands which will just secrete. There are some type of cells which will just say the glands which will just secrete. There are some type of glands where their apex, that apex is chopped off and it is released into the duct. And some of the type of glands are like in which the whole cell gets destroyed, is broken, and it is put into the duct. So these are the three different type of ducts. These are the three different type of secretory mechanisms which we'll be understanding today. So today we just see parotid duct and secretory portion and secretory glands itself, sublingual and submandibular. Right? Our whole idea is that they will be looking like a simple cuboidal. Now we see that, and it is like such an artistic work. Right? So over here, we are not watching only the glands. In fact, all these are fat globules, right? These are flat globules, right? There are some muscles also, because it is a whole cross section. So it is comprising of arteries, small arteries. It is comprising of those ducts, right? Fat tissues, connective tissues, muscles are seen, So all those, and as we zoom, right, this one, see, even in this, right, this is a big duct, correct? Over here, a huge duct. All others are pretty small, and when we zoom this thing, here it is. How artistic it is. This is carotid duct. Right? Beyond doubt, right? We see that these are all round, right? And see, like a garland, right? Mala, right? All round, right? How nicely they are seen. This is oily version. That's how they are arranged, right? So this is one. So that's parotid duct. Right? So this is how the ducts are seen. The next one. A small variation. A small variation. So this is, if you see, this is a simple columnar. Now, we saw the squamous, right? Squamous was like this. Then we saw cuboidal. Cuboidal was like cube. Now this is what is called as the column. So they are like column. This is called as column. And in column, the nuclei would be like this, right? It would be round or oval shaped basal nuclei, right? And they are dark stained. So the nuclei, it could be like this, and it could be, sometimes it could be like this, right? Like this. But when you will really draw it, you'll find that they will be more towards the base. More towards the base. So this is how they will be looking like. There are two variations. Either there will be some structures which are called as cilia, right? These are the cilia whose function is to propel the structure. So for example, in fallopian tubes, right? So when we'll see fallopian tubes, so in fallopian tubes, we'll find that they are ciliated, because when that ovum comes over here, right? So they just push that ovum, right? So it literally moves like a grass, right? So it will keep on pushing. So is it a very serious thing? Yes, it is a serious thing, because in case if there is any problem to this development of the cilia, right? So that movement would be restricted. And in case of males also, right, this loss of the cilia, that can lead to some very big complications. Okay, so coming back to this, so this is a single layer of column shape. So over here, what we'll be watching is non-ciliated. So non-ciliated means this is like our normal, the way we are learning, right? Our squamous, cuboidal, and the simple columnar. Right? So single layer of column shaped, round or oval. Remember this basal. Till this point of time, we never said basal, because the cell itself was so small. What basal, right? What half or cell itself was so big, very less amount of cytoplasm is there. But now the cell's height has increased, so that's why its shape is like this. So we are telling that if we divide this, the cells, they would be mostly into the basal part, into the lower part. Large amount of cytoplasm, because as I said, this upper part is empty, so it will be cytoplasm and presence of some goblet cells. This goblet cell, non-ciliated has long and ciliated has round nucleus. Not really. Means it is, no, I should not draw it like this. Right? Good question. Nuclei can be round or oval, right? And it has got nothing to do with cilia. Right? Cilia can be present over here. Cilia can be present over here, whether it is round or oval. Right? And presence of goblet cells. These are the unicellular glands. Right? Again, when we'll be discussing glands, we'll be seeing in more detail. But what you have to understand is goblet cells, they are not stained. So that's why they will be looking like round empty spaces. Right? They will be looking like round empty spaces. We'll just watch that thing in a minute. Empty spaces. So very, very distinctly they are seen. Presence, it lines digestive tract from stomach to anal canal all the way. Right? But there are microvilli when it comes to intestine. Interesting, right? So all the way from stomach, duodenum, right? Stomach, duodenum, jejunum, ileum, right? And these are the areas which are of intestines, right? Then you have got the large intestine, right? Ascending, transverse, descending colon. Then there is the sigmoid colon. Then there is rectum and anal canal all the way. But we are watching it that duodenum, jejunum, ileum, and large intestine. These are the areas where we'll be watching same type of cells, but they will be having cilia. Right? So these are the microvilli. Microvilli will come to this. Gallbladder, very important. Uterus, some portion, and the uterine tubes, and the excretory ducts of some glands. Right? Let's see this. So here it is. We are watching the intestines right here. As we zoom, right, no doubt about it. Correct. See, this is on 60x. Right. So where exactly are we watching? See, if this is the tube, right? So then it is this surface which is thrown into these folds, right? And we are talking about these cells. We are talking about these cells. We are talking about these cells. So this is the lumen in which the food will be there. Correct? So watch over here. Here it is. Right? So here is the lumen. So out of that entire tube, right? And when a section is taken, so this particular wall is what we are watching. See, otherwise, you might ask, what is this? Nothing. It is just one villi, the second villi, third villi. One was like this, and the section it took. So it might see some of the sections they might be looking like as if they are disconnected, right? Because the section is taken. So watch these type of cells. Here it is. Only two things we will be watching. Either they are oval or they are round, yes, and they are more towards the basal. So this is the base. This is the base. Pecani cell. Right? And that's the nucleus. So all of them, they are more towards the base, right? So over here, this is the base. Base. Right? All the way. See, these are very dark stained. These are very light stained. But all of them, they can be seen very clearly. And see, these are goblet cells. Here it is. Goblet cells. Here is another goblet. Here is big one, big goblet. Right? Here it is. This one, goblet. See, right? So that's the lumen. Got it? So this is how they look like. This is this of uterus. In histology, there are two things. One, the cellular histology, which we are learning right now. And second is the systemic histology. So systemic histology, when we'll be understanding it, so at that point, we'll be discussing, let's say uterus, so then we'll be discussing only uterus. So that means that what are the, say if it is the uterus and that's the fundus, we take the section. So then what are the type of cells over here? What are the type of muscles? What are the type of arteries? How they look like? Which cell is what? So we'll be focusing only on one particular organ, that is the systemic, right? So first it is important to learn the cellular part. So here it is. This is once again the cavity. Correct. So if this is the uterus, so cavity is here, right? So this is here. So the section must have been taken like this, right? And then we are watching like this portion. That portion. Still zoom it further, right? And see here. Beyond doubt, basal, right? Oval, nuclei. Right? Some oval, some are round, right? But they are seen very distinctly. Here it is. And this is the 100x. Still further. Right? So that's how they will be looking like. By the way, this is gallbladder. Yeah, this is gallbladder. So in this, typically pretty oblong. Now you should be able to clearly differentiate between three types of cells, right? Beyond doubt that what is what, right? From the nucleus. We now change to this. This is ciliated. Right? Now we are talking about the ciliated one. Same simple columnar. So single columnar, round or oval shape. This is same. This is same. This is also same, but there is presence of cilia extending from the apical surface. So if this is the surface, this is called as the basal surface, this one is called as the apical surface, and from the apical surface, we should watch something like this. Right? It might be thin, it might be thick, long, that will vary. So where do we see that? One, it lines small bronchi, because small bronchi, they have to push that sputum out, mucus out, right? Constantly they have to push the mucus out. So this is one. So this tells us that in case of many of the diseases, when these are affected, yes, mucus will be remaining over there only, right? Uterine tubes also called as the fallopian tubes, right? We talked about it, fallopian tubes. So obviously very much needed, because their function is to push, to roll that ovum all the way into cavity. And in uterus, some portion, not the entire portion. Some portion is what? Because once that ovum lands over there, it is necessary, once if it gets fertilized, it is necessary to embed it, right? So to take it all the way onto the uterine, so that's the fallopian tube. That has come over here, but now it is necessary to embed it into the wall so that it starts growing over there, right? So that's why in uterus, some portion. Let's see. Without any explanation, you'll be able to see and understand it clearly. So these are with bronchi, right? This is bronchi. See, some delicate structures, right? Let's zoom. Now it should be fine, right? See, the nuclei, basal, and the apex, and on the apex, all these pinkish things, all these, right? This complete layer, this, all this, right? These are the cilia. See here how nicely they are seen. They are the cilia. This is 100x, right? They are the cilia. Fallopian tubes, right? These are the fallopian tubes. These fallopian tubes, they have got multiple folds inside. This is 10x, this is 40x, and this is oil immersion. See the richness of the cilia. These are the uterine tubes. A portion enlarged. Right. So that's the difference between ciliated and non-ciliated. The next one is, now this is something which one can never see in reality. This is what is called as the pseudo-stratified columnar epithelium. Now we talked about simple epithelium. Whenever we use the simple word, that is one layer, right? One layer. When we shall be using stratified means there would be multiple layers, right? Multiple layers. So when there are multiple layers, that means how will we identify? We'll be identifying that if it is stratified, remember, stratified cuboidal. So cuboidal, they were having round. So if we see the layers like this, so clearly one layer, and then like this, right? There are multiple layers of nuclei. So we know that there will be multiple layers of the cells. So they will be called as the stratified. So that's the way we understood simple, squamous, simple, cuboidal, simple, columnar. Exactly the same way there would be stratified squamous, stratified columnar, stratified cuboidal. But this is pseudo. Pseudo means not really, right? Its literal meaning is not really. So this looks like stratified columnar epithelium, but it is not. So what type of it is? This is a single layer of column-shaped cells. So column-shaped cells, that means it is columnar, right? Differing heights, their heights are different. Some will be larger, some will be smaller. So that means if we really want to draw it, we will be drawing it something like this, right? Some cells are like this, some cells are like this, some cells are like this. So everyone will be having their cells. So this thing can be misinterpreted as that it is a stratified one. Nuclei, they are located at different levels, right? So we might misunderstand or misinterpret as that they are with multiple cells. Goblet cells are common. Both ciliated and non-ciliated types exist, right, in pseudo-stratified columnar epithelium. So this is how they will be looking like. That the point is that because the cell's height, they keep on changing. So in case, especially in case of trachea and upper respiratory tract, they will be ciliated, right? The sperm carrying ducts, epididymis or vas deferens, they are non-ciliated. So these are the areas where these pseudo-stratified columnar epithelium cells are present. So how do they look like? Over here, just zoom this thing. This is trachea. This is the trachea. What we are watching is trachea. Why trachea? Because the big cartilages they are seen. Right over here, the cartilages are seen. So this is trachea, and as we zoom, see over here, right, ciliated, and see these cells. Right? The cells, it looks like, right, as if they are at various layers, but some cells are big, some cells are small. So that's why it is looking like this. When you'll watch stratified squamous, you will find that they are very systematically arranged, multiple layers. Right? See this. So here, easiest method in case of pseudo stratified is that they are bit of, you have to watch it in this with low resolution. In exam also, you'll be allowed to change the resolution. So you can watch that they are bit disorganized. Right? They are bit of disorganized. Big, small, right? All these cells as if they are arranged in multiple layers. But truly speaking, they are like single layer but different heights, typically present in these areas. Now, as we'll watch stratified, immediately this will be clear. So I'm keeping this file open so that we can come back and compare. We are watching now stratified squamous epithelium. Right? So stratified squamous. Stratified means it will be having multiple layers. So that's multiple layers. Nuclei, same style, distributed throughout. What type of nuclei? Well, they will be squamous, right? So that's why we'll be watching the flat nuclei, right? Flat nuclei. Basal cells. Now see, we said that this is one layer, then there will be second layer, right? There will be third layer, right? There will be multiple layers. Always remember, the name goes as per the basal layer. Name goes as per the basal layer. So basal layer is cuboidal or columnar, and they are metabolically active. This basal layer, right? This basal layer is always metabolically active. In many of the cases, you'll see that the layer which is far more layer, right? It might be keratinized, right? We'll watch that also. Keratin is like a dead substance. So where they are giving some sort of protection, so they will not be so metabolically active. But basal layers, they are always very much metabolically active. Basal layers are metabolically active, then and then they'll keep on generating more cells and they'll keep on pushing it up and up and up, right? So that's why the most metabolic, this was one of the questions, right? So metabolically active layers, they are the basal layers. Apical layers, apical cells, they are flat and squamous, right? So these apical cells, in this case, right? Apical cells, we are watching it that they are bit flat. Keratinized types, surface cells filled with the protein keratin as it comes. So keratinized and non-keratinized. Keratinized means these are the epidermal skin. Now see, where do we really need this type? Wherever the protection is needed, right? So skin, epidermis, that is bit rough, right? Keratinized. There are two subtypes, ortho and parakeratotic. In orthokeratotic, no nucleus is seen, just one simple word. And in parakeratotic, retention of nuclei. If the nuclei is present, right? So P for P, present. So parakeratotic, orthokeratotic, or you can say zero, right? You can just write it like zero. Ortho means no nucleus, zero nucleus. So over here, zero nucleus. And in this, presence of nucleus. So this is clear, right? How the keratin will look like, we'll just see. Non-keratinized, so this is where there is extremely soft area. So esophagus, vagina, and the anus, right? These are the skins which are very thin, so that's why there is no keratinization. If there is any keratinization, so that is the abnormality. So here it is. See, this layer adds keratin. You just watch it and you'll be able to see it. See this layer. As we zoom further, and as we zoom further. Wait, I think I made a mistake. Name goes as per the top layer. Okay, so let me write it over here. Because I remember I told you name as per basal. No. Name of cell surface as per top layer. Now it is okay. Top layer, right? top layer. So it is this top layer which is squamous, right? It has got the round or the flat nucleus. So that's why we'll be calling it stratified squamous. And what about the lower layers? Lower layers are metabolically active. So when they are metabolically active, they might be having big nucleus, right? And as they will go towards the surface, they'll go flat, right? So now we see it over here. Now it is. See, this is our keratin, correct? That's the keratin. This is the surface, right? The topmost surface. The topmost surface is having those flat single layer, right? Single flat, right? So these are the flat nucleus. But as you go deeper layers, right, are highly metabolically active, right? Highly metabolically active layers they are seen at the basal layer, right? See, so many layers, no confusion, right? See, now if you compare this thing, right? See this basal layer, right? Basal layer. See big, and then bigger one, they are going up. Now over here, right? All are cells, all the way. These are all various layers of cells, but we are not watching because sometimes the layers they are broken as such. You can see the cells individually like this. When you get the file, just zoom it and see it, right? But see, this is compare this image with this one. With this one, see, right? Practically speaking, these are the layers, right? And when you compare it with this, are totally different, right? See how well organized, and then all the way when they go on the top, they are organized into a single this. See the layers, one, right? How nicely you watch all those layers. See this, right? Over here, from big cell coming around, and then they are small and flat. So these are called as the stratified squamous. Now with this watch, I know that. Stratified cuboidal, right? Stratified cuboidal. So there are two layers of cells. Nuclei is round, plus it has got two rows at C. And apical layers, they are like cube shaped, right? So apical layers, that's why the name is this. They are largest ducts of sweat glands, right? Largest duct of sweat glands, ducts of salivary glands, and duct of mammary glands, right? So over here. See the ducts. Here it is. Similarly, this, we just zoom this, and the best image, where it is very clearly, it is like two layers, one layer and the second layer, and the second layer. Now this is not like mathematics that at every spot there will be two layers, but truly speaking, there will be two layers. But sometimes when during this section, some section has become overlapped, so it might look like over here there are more layers. But practically, watch this. Right? So these are two layers. Watch this. This is also very good. Right? See all the way as it flows from here. Now this thing, it looks very geometric. You'll find that there is very less mismatch, right? This is a very typical, but all the way, even if you see at a lower resolution, you'll find one layer and it is followed by the second layer. So thus these two layers, they are going on. Here it is seamless. So two layers, two rows, an apical layer that is a cube-shaped cells. So largest duct of sweat glands, duct of salivary glands, and duct of mammary glands, they look like this. On to the last one. This is stratified columnar epithelium. Here also there are two or more layers, nuclear round, many rows. Apical layer is columnar, and that's why the name. Basal layer is usually cuboidal. So from cuboidal, it will become, which one? How is this cuboidal? Which one? This one. Previous one. This. Cuboidal because cuboidal, it has got the round nuclei. Correct. Cuboidal has got the round nuclei. So over here, as I told you earlier, that many times we won't be able to see the entire cell, but we can see the nucleus. That's why our entire focus shifted from shape of the cells to nucleus. Otherwise, in books, you'll find that it is written that cells are this cube shaped with same height and same width, etc. Totally agree, right? In real tissue, but when we see it in histology, we don't see the cells many times as we are watching it over here, but we always see the nucleus. So this nucleus is round shaped, correct? All are round shaped, that's why definitely, and it is arranged in multiple layers. So we can say this is stratified because it is in multiple layers, and because it is round, most of them, they are round, right? So that's why we are telling it is cuboidal. Am I clear, Nilaja? Right? So this is how it will look like. Watch all of them, right? Over here, it is crystal clear. And now compare it with this. Right? Straight away, I'll show you that. Here it is. Here, watch this. Now there are few round also, but there are even, see most of the nuclei, right? They are oblong, oval, right? Most of them, they are all the way, right? They are oval. So what we are talking about over here is this, right? Basal layer is usually cuboidal cells, and apical layer, they are the columnar shaped cells. So this is how it would be looking like. So the basal layers, they are cuboidal. So that means we might see the nuclei round over here, and then there would be multiple layers, and then the layers would be like this. Correct. And in that case, the nucleus will be looking like this. So that's apical. Because apical, it is columnar, and this is basal, which is cuboidal. Right? But because multiple layers are there, that's why it is stratified. Watch it. Where is it? Largest duct of some glands and male urethra in some portions. They can be ciliated, non-ciliated. Yes, that thing would come, right? So male urethra, because in male urethra, so in some portions, so that's why this goes into the systemic histology, where we'll be discussing that different parts of the male urethra and what type of cells are there. Right? So here it is. See the basal. They are round, basal, they are round, and this one is the lumen, right? This one is the lumen. So as we go towards lumen, they will be all apical, and that's how they will be looking like. Right? Apical, you are finding it that they are more columnar. That's why this is stratified columnar, right? The final file of today. Now this is what is called as the transitional. Transitional means it is on either side. This is seen only in some of the organs. So transitional columnar epithelium. So this is when the tissue changes its shape. Right? So there would be multiple layers of cells. Say for example, bladder, right? Urinary bladder. So this urinary bladder, from both the sides, there are ureters, and those ureters, right, there are muscles, and say this is a cavity, right? In between the cavity, urine starts getting filled up, coming from both the kidneys. As there are stretch receptors, so whenever there is a stretch receptor, this thing will relax, so that the micturition reflex, urge to go to washroom, it goes away, right? And fluid continuously gets collected. Now there is a amazing mechanism of micturition reflex and the process of micturition, how the urine is passed, right? Because it involves both the thing. One, there are sphincters. Sphincter means something which prevents the leakage of urine, right? So in case of male, there are two sphincters, external and internal. In case of female, there is only one sphincter. So when you listen to the patient that they are unable to hold urine, that means those sphincters, they are not working properly. In some of the cases, you find in case of those patients, constantly the catheter has been kept and it is connected with the urinary bag, right? Urine collection bag. So this is because this bladder is unable to perform those functions. So whatever the urine is coming, immediately it passes. Actually, there are sphincters which stops that, right? So this particular urinary bladder, it has got what we call as the ability to stretch, right? So in such cases, their cells are different. In the relaxed state, these cells, they appear cuboidal, but when they are stretched, so they become squamous. And that's the reason it is called as the transitional. Transitional means in relaxed state, they are cuboidal, right? They are cuboidal, so this is how it look like. But when it is in stretched state, so that cuboidal, it becomes flat. Very special typical cells, right? And they are called as the transitional column. You'll find that thing into urinary bladder, ureter, right? And lining of superior portion of urethra. Right? Only the superior portion of urethra. This is what we shall be discussing into systemic histology. When we'll be discussing the entire urethra, so why it happens like only in the superior portion, these type of transitional epithelium cells are there, and then they later change. Right? So here it is, as you will see. Right? Most of the cells in this case, they are all round, right? Because obviously the person has died, right? The bladder has been taken out. Obviously, it will not be into the stretch state, right? Relaxed state, and the section is taken. So over here, we see that most of the cells, they are like cuboidal cells. This is a concept, transitional columnar epithelium. This is a concept. Many times asked in why. Right. So these are the basic histology. Saved all of them. All right. So every file has been saved, and I'll be transferring all of them into our shared folder. Right? I'm preparing one extra new folder. It is histology, and in that histology, I'll make this structure, right? Histology. In that, I'll make one folder that is the basic, right? And then, as we'll discuss, right, we'll keep on adding the new folders into it. All the file of today's discussion will be lying on this, right? So just see that accordingly. All right. So thank you so much for your patience, because histology lectures, they are usually a bit long. Right? Tomorrow we'll be discussing all the various types of glands and something more about it. Right? So see you tomorrow. Take care. Thank you so much. Bye-bye.
शुभांगी मॅम, शुभांगी मॅम, तुमचं APSC ला काहीतरी झाले. न्यू सॉफ्टवेअर इज अवेलेबल फॉर्म अप्लाय असं क्विट म्हणून इन्स्टॉल आयटम म्हणून आलं.